Transient tachypnea of the newborn, a self-limiting respiratory condition in newborns caused by delayed clearance of the fetal lung fluid, leading to transient respiratory distress. Etiology: most common in term are the late preterm infants delivered by the cesarean section without labor. Other risk factors like male sex, macrosomia, maternal diabetes or the asthma, precipitous delivery. For the pathophysiology, fetal lung fluid retention impairs the gas exchange, delayed reabsorption of the fluid due to inadequate activation of the AMPA. For the pathophysiology, the fetal lung fluid retention impairs the gas exchange, delayed reabsorption of the fluid due to the inadequate activation of the sodium channels in the lungs, results in the decreased lung compliance and the mild hypoxemia. Clinical features like symptoms usually appear within the first few hours after birth. Tachypnea, respiratory rate greater than 60 breaths per minute, mild respiratory distress, nasal flaring, grunting, intercostal retractions, cyanosis mild and intermittent. Normal or near normal APGS scores at birth. Diagnosis based on the clinical presentation and the exclusion of the other causes of the respiratory distress. Chest X-ray finding prominent perihilar streaking sunburst pattern, fluid in the interlobular feature, mild cardiomegaly, hyperinflated lungs with a flat diaphragm, blood gas, mild hypoxemia, rarely severe. Differential diagnosis like respiratory distress syndrome, neonatal pneumonia, persistent pulmonary hypertension of the newborn, meconium aspiration syndrome. Management: supplemental oxygen for the hypoxemia, continuous positive airway pressure in the moderate cases, fluid and the temperature management. Avoid the aggressive intervention unless the symptoms worsen or persist. Typically resolves within 24 to 72 hours. Prognosis: excellent, no long-term sequelae in the most cases. Rarely progresses to the respiratory failure if other underlying condition exists. This is the most common cause of the respiratory distress in term and the late preterm infants. Caesarean delivery, maternal diabetes and the male sex, caused by the delayed clearance of the fetal lung fluid. Key symptoms: tachypnea greater than 60 breaths per minute appearing shortly after the birth. Chest X-ray finding perihilar streaking, fluid in the feces and the hyperinflation. Differential diagnoses include RTS, pneumonia, PHVN and the meconium aspiration. Management is supportive, oxygen therapy and CPAP if needed. Resolution typically occurs within 24 to 72 hours. No long-term complication if appropriately managed.